I'm excited about a couple of things. One is that there are consensus statements that are coming out in the rehab field. So in the past, we might want to refer to PT-OT speech, but then they're used to seeing patients with stroke or with a motor deficit from a tumor or a resection. And they're used to treating that. But then when you bring in, well, there are also some psychiatric and psychological elements to this motor weakness in motor FND or in a motor movement disorder, functional movement disorder, psychogenic movement disorder. And so the consensus statements, which are now readily available, and we distribute them to colleagues in rehab, you'll see in the language, it's not just about getting them to walk. It's also about having an empathetic engagement with the patient and recognizing that this is a real and disabling condition for some people. So there's some validation and there's encouragement. It's about the consensus statements, again, from OT and PT say, take time to listen to the person's story and build a therapeutic rapport. And to help to allay some of the fears and concerns and anxieties when the patient is having difficulty doing the movement. So I tell people what they're doing is PT squared, which is they're doing physical therapy and they're also doing psychotherapy. And again, when you build those bridges, that's where you're going to be able to help people from a brain, mind, behavior perspective. So that's one advance that's exciting. A second advance is we have been funded to look at biomarkers in patients with conversion disorders and functional neurological disorders. So we had 3 groups in our study. The control or the comparison group were patients with traumatic brain injury, TBI, and no FND symptoms. And then the second group was TBI plus epilepsy. And then the third group was TBI plus non-epileptic seizures. So we had 2 seizure groups, one with epileptic and one with non-epileptic seizures. And then we had, and with TBI, and then the comparison group of TBI, because we wanted to have symptomatic cohorts, not just healthy controls, as a comparison group. And so in that study, we did structural and functional MRI before, then we did the 12 sessions of the neurobehavioral therapy with the 2 seizure groups. And then we did structural and functional MRI afterwards with symptom scales before and after, and also looking at seizures. In the literature, we've been able to publish a significant amount on the baseline characteristics so that we can kind of show that we've deeply phenotyped these people and these cohorts. And then now, just recently, the post-treatment neuroimaging comparisons are being published, being submitted and published. And we are seeing neuroplastic changes in the patients who had the seizures in the groups with seizures. So we found, we identified white matter changes after neurobehavioral therapy in patients who had non-epileptic seizures or functional seizures, and they were associated with improved psychosocial functioning. And so there are new diagnostic techniques that can be incorporated into neuroimaging protocols that might help to pair or to be able to see neural correlates and neural connectivity correlates with behavioral change in this population. As you've probably seen, there's growing interest, not only in neurology, but also in mental health. This increase, some of it, I think, is because of the progress that's been made in the past 10 to 20 years. Many times, clinicians would avoid this challenging population because we had difficulty making the diagnosis. We had difficulty treating them, and we didn't understand some of the neuropathophysiologic mechanisms. We understood the psychological mechanisms, but we didn't have the neural correlates. And what's been happening over the past 10 years is this advance, this great advance in diagnosis and treatment and understanding mechanisms. And so it's an exciting time. And I tell people, now that we've got these tools, we can be equipped to help treat and care for these patients. It's very fulfilling clinically, and also it's powerful to see the transformation that occurs in many of our patients' lives.